No.
No? Okay, fine. So what is a car scan? When do we use it?
It's a quick tool to look for, usually using A&E or trauma
Yep.
circumstances, just to look for any major pathology that might be the cause of their admission.
Yeah, exactly. So trauma can be in stable, unstable patients and looking for blood loss. Where? 3 places. Where would you be looking for?
You can see
The
free
abdomen.
fluid in the peritoneal cavity
Yep.
around the kidneys.
Abdomen, pericardium, and
Hemothorax,
yeah,
chest.
and the chest. So that's what I'm going to teach you today. Quick look at the machine. Do you know which probe you use? It's kind of obvious because I put gel on it. This one is called the curvilinear probe. It's a low frequency probe, and that just means that it can go deeper into the tissues. So these ones you can use on things like musculoskeletal, eyeballs, testicles. This one's great because it's got a small footprint, so it's like a triangle like this, and you can fit it between ribs. So it's great for looking at the heart. But for this, for the purpose of this examination, we'll be using this. When you use a scan in emergency ultrasound, that's the indicator at the top. There's always one on all of the probes, and the general rule is that the indicator always is head up, okay? And if you're not doing it head up, then it's always to the right of the patient, and that's all you have to remember. So, does anyone know where exactly you would place the probe? There are 4 places.
Between the liver and kidney on the
Yeah.
right hand side.
So right upper quadrant.
Yeah.
Right upper quadrant.
And then you come round to epigastric,
Yep. So
and you're looking at that one.
subcostal. 2 more.
Where do you look for the AAA?
So AAA is not included in the fast scan.
Okay.
Do you know why?
Is it because that probe you need to use it?
No, that's the one that we would use because it still goes deep into the abdomen. But it's because the aorta would be a retroperitoneal bleed, so you can never use it in terms of looking for free fluid,
Yeah.
but you can use it to look and see if the aorta is
It's
really
enlarged,
big.
yeah.
Yeah. So the other places are the left upper quadrant and also suprapubic. So do you know which one is the most sensitive to picking up blood in a supine patient? In the abdomen, for the abdomen.
Right.
Yeah.
Upper quadrant.
And do you know what that space is called?
It's in between the liver and the kidney.
Yeah. Do you want to know? It's Morrison's pouch, so it's like the shop. So when you're, we'll start with the right upper quadrant because it's the most sensitive for picking up blood. You've got your landmarks that you need to see, which are the liver. So just imagine this is the probe, and usually there's a little mark to say that there's the indicator. So in here it's probably this one. So if you're placing your probe like this, indicator is facing up, that effectively means you're placing, this is what you're seeing, the probe like this, except you have to imagine it like this. So if your probe is here at the top and you're going deeper in, apart from your ribs and your muscles, because that's always the first thing I get told when I ask this question, what's the first thing or organ you'll see?
Liver.
Yeah, liver.
Liver up top, kidney.
And
Gallbladder?
kidney below, yep, and you might see a gallbladder. And what might you see at the top here?
Diaphragm.
Yeah, and that will look like a bright white line. So then what would be here on the image? Yeah, lung or blood, if there's a hemothorax. Right, exactly. So the most sensitive place is in between the liver and the kidney, but you can also see around the bottom of the liver, which is the liver tip, and also you can see around, just around the kidney anyway, okay? It's the same on this side, so what would you see? Spleen, kidney,
Diaphragm.
and diaphragm. And
lung.
thorax. Yeah, exactly. So again, that's exactly where you'd see it, except for the left upper quadrant, you're more commonly going to see the blood around the spleen. Then if you're doing suprapubic, so indicator will go to the right of the patient, like this. Bam, bam, okay? So what would you be looking for here? apart from blood.
We'll see
What are
bladder.
the
What else are we
what-
gonna see?
yeah, so bladder. And commonly it will be behind the bladder. What's the space called? If it's a female.
It's another pouch
Yep.
of Douglas.
Yeah, pouch of Douglas for a female. So that's between the
Uterus and the colon, or between the bladder and the uterus.
yeah. No, between the colon and the uterus. Yeah, you're right. And then if it's a male, they don't have the uterus, so it will be between the colon and behind the bladder. And then up here,
Parsley, huh?
yeah,
You can
So-
pull view though, isn't it?
yeah.
Pull.
What helps you to see the heart? So you know when you do a scan, sometimes if you're looking for things in the abdomen, they might tell you to drink lots because the bladder creates a better view. What might be here has lots of fluid that helps you to see the heart? No? No?
Just check the cards you know. You stay focused.
No, so that's bone. Bone is bad.
So bone.
Come on in.
So take a deep breath.
So the liver's full of it is a very vascular organ, so that will help you to see the lung. Okay, so that's your 4 places that you would look for free fluid. There's also the extended fast scan, which you can put either of these probes on the chest wall, and then you can see a pneumothorax. It's actually more sensitive than doing a chest X-ray.
Apically.
Here,
Yeah.
here, here. Yeah, but because it will just make this teaching a little bit too long, we'll just focus on these 4. So, we've talked about the landmarks. I'll just quickly show you what the pictures look like. So this is a right upper quadrant, this is normal. So diaphragm, liver, kidney, and above that is your lung. That's left upper quadrant, where you find potential spaces.
Maximize that.
Spleen,
So
kidney.
just below the diaphragm, just spleen, which is the white diaphragm. And that's the kitchen.
So this is, where's the top of the patient's hip?
So this side.
And this side.
If the indicator is here,
That's the
and
head
your
of the
indicator
patient.
is going always facing up, that side will always be the head. Okay. So those are potential spaces for left upper quadrant. And then we've got suprapubic. Can you see it okay without me maximising it, just because it's
Yeah.
a little bit quicker? So that's uterus. Sometimes you can see a vaginal stripe as well for a female, and then that's bladder, and then that's heart. So the first thing you'd see is the inferior aspect of the heart, which is the right ventricle. Yeah. And then the big thing next to it would be the left ventricle, and then you can figure out the chambers from there. That's the most sensitive place, is in the inferior aspect for fluid collection, and that's where you'd see
Pericardium.
yeah,
Piece.
exactly.
Mhm.
So, should we start scanning?